Hey everybody, it's Ed Dellert here, and another opportunity that I haven't had the pleasure of really digging into in one of these broadcasts out to the membership, and the opportunity presents itself right here today, which is really talking about physical and occupational therapy and how it is evolved, things that are occurring in the landscape of ABA and within the burn community at large. And I've got Derek and Marla and Lisa here to educate us all really about where things are going present day for physical and occupational therapy and what maybe is trending into the future. I'm gonna ask Derek if you don't mind introducing yourself, and I'll go around the room here real quick.
Thank you, Ed. I'm Derek Murray, physical therapist, Arizona Burn Center. My role there is supervisor. I'm a burn certified therapist. I've been in practice for about 24 years. Thank you.
Excellent, thank you. Hey, Marla, good morning.
Good morning. I'm Marla Robinson. I'm an occupational therapist at University of Chicago Medical Center. I've been a therapist for about 32 years. I am a certified burn therapist as well, and my day job is director of inpatient therapy for our health system.
Excellent. Lisa?
Hi, everyone. Lisa Forbes. I'm from Winnipeg, Manitoba, Canada. I'm currently the manager for the occupational therapy department in the Health Sciences Center for about 4 years. Prior to that, I was a burn therapist for 30 years, and I am also a burn therapist certified.
All right, excellent. Thank you, all three of you, to join me on this. I have had the opportunity recently to go visit down in Dr. Cancio's burn center earlier this month, and I had a chance to meet up with some of the physical therapy staff there. And they continue to educate me more and more and more in regards to not just in the acute phase of a burn situation or patient, but also into the chronic aspects of things, which then presents a lot of opportunities and I think challenges depending on your state of practice of where physical therapists are located at. I really wanted to get your perspectives on what you do think are some of the biggest opportunities and challenges in and around the therapy area in the field right now that you might be able to share with us. So I'm going to kick it off to whoever would like to answer those questions.
Okay, maybe I'll get started. One of the questions that you sort of asked us to, I think, reflect on is sort of what great burn therapy looks like and what are the opportunities and challenges. So really, the first word that comes to my mind when I think of great burn therapy is passion. And I think that that's what I really see of the burn therapists that I know. And it's really an area that people are drawn to or they're not. And I think the best burn therapy happens. It's just better when someone really wants to be there. And I think that's kind of what I've seen throughout my career, the therapists I've mentored and worked with, as well as the therapists I know from the American Burn Association. It's a very passionate group of individuals. And I think that great burn therapists really strive to, they're always asking why, they're always questioning, what can I do better? So that's kind of the word that jumped out the most for me. And I think that the best opportunities that we can have is really using the available resources. I am from a center that's a very small burn unit, and my entire career, I really relied on the network that I developed in terms of the American Burn Association. So it felt very lonely and isolating being in a small burn unit. And I know that I really relied on that. I would never have learned what I learned if I hadn't have reached out and developed a real strong network of therapists that worked in the bigger burn centers and saw way more burns than I saw in a year, and just collaborating with those colleagues. Really, for me, that was really what led me to be able to do the burn therapy that I did. And so I would really encourage people to use the resources that we have, using available literature, read what's current, use what's up to date. If you're not really understanding it in practice, reach out to, people who have been practicing for a long time. And we really do have a lot of opportunities within the ABA. We have the OTPT Special Interest Group. We have My AmeriBurn. We have courses and webinars all the time that are online and happening. So I would really encourage people to use the available resources. And I think I'll hand it over to you. Yeah, go ahead.
Elisa, I'm going to come back to the resource because, in my travels, I see such variation on the resources and dynamics depending on what's available in there. And I really want to get your three perspective, but I want that's coming up next. So I think we're going to turn this over to maybe Marla, I guess.
Yeah, no, yeah, and I think Lisa did such a beautiful job of highlighting the important components for great burn rehabilitation. Some of the things that I think about when I think about what is really great burn care, it's comprehensive, it's holistic, it's evidence-based, it's team-focused, and it's patient-centered, right? That at the heart of everything that we do are our patients, and really how do we optimize their outcomes to ensure that they have a really healthy quality of life. I think some of the challenges that Lisa touched on are time and resources. And when we think about one of the opportunities that we have is, we have burn therapist certification that was developed through the American Burn Association several years ago now. That is an opportunity for our clinicians and PTs and the OTs to be able to highlight the skills that they have, the quality that they bring to the table, because our burn therapists, they are able to really synthesize and use advanced practice to pull together the evidence that's out there to apply it. And then they're the people who are identifying those gaps that we have in knowledge, practice skills, and they're the ones that are creating, the evidence that's being published for our, to continue to evolve the care that we're providing. And so just a quick plug for burn therapist certification. And I'm going to pass it over to Derek to talk a little bit about how it connects to other areas of practice and other areas within the American Burn Association to be able to share that a little bit more.
Thank you, Marla. And what a great synopsis of what great therapy looks like by both Lisa and Marla. I'm going to add a perspective from verification. Some of you may or may not know that the verification criteria have shifted and changed. And the verification committee now through the PRQ is incentivizing certification because we feel like to answer the question of what does great therapy burn therapy look like, it can look like a certified burn therapist. Certainly, we can, sort of label that now a little bit. So we do encourage centers to offer incentives for therapists to pursue certification. That is a new criteria actually in the PRQ. And for the past several years, when we go on site visits, we have been encouraging those specific sites to have at least one of their therapists or more pursue certification because we can see in the program perspective the impact that burn certified therapists have in the successful patient care of the organization through verification that lens. So it's sort of been exciting to see how BTC has evolved from a concept of a few people to engaging and embracing the therapy community to engaging and embracing the patients that we serve. And now, of course, the process that we vet quality care through the American Burn Association.
Derek, I want to follow up on the verification a little bit because I just got done doing a site visit with on verification the last couple of days here, and there was a physical therapist in the room and talking a little bit about their resources that they have available. Do you all see that as an opportunity, especially if they might not have all the resources present day available to them? Is verification a springboard to kind of help the burn center to maybe aspire to get those, some of those resources in place? What are your thoughts about that?
I think you hit the nail on the head. I think verification is a springboard. When you look at verification in terms of like we have a black and white PRQ and there are these criteria that you meet, that is one facet of what we look at. But in reality, what we're trying to do is work with and partner with our burn centers to coax out better quality care in ways that are possible for them to achieve. So absolutely, we look at trying to pull them forward, give them ideas that are workable and doable. And if you look at the criterion itself for certification, that's built into the language of it. We say that the center should incentivize BTC in a way it incentivizes other certifications or advanced clinical growth within its network. So if you have a clinical ladder, for example, then BTC should be included. If you are offering, some sort of cost offset for certification, you should offer that for BTC as well. If you're doing none of those things, then you're setting aside some time and some structure to allow your staff to pursue BTC is something you can do to encourage.
Excellent. Thank you for that. We're talking about a lot of the different opportunities. What are some of the challenges that you're experiencing in the community there that you'd like to highlight? And I'll let anybody tackle that one.
Well, I'm happy to tackle that one. So, from an administrative perspective, and all of us here in this call have administrative perspectives, and we all feel this to a degree. But we know there's a consistent, at least in the US healthcare system, and hopefully Lisa is exempt from some of this in Canada, but there is always a consistent downward pressure on reimbursement for healthcare systems and hospitals. So we know that there are already, codified Medicaid cuts coming, and we're going to realize the impact of that, upcoming soon on our patient populations. They'll reimburse less. So what happens is when there's a downward pressure on your healthcare system, that trickles down to the therapy departments because the hospital can't afford to have as many FTE on its staff. And so for therapists, what that looks like is you run into a scenario where you're encouraged to handle ever more patient volume per therapist workday. At least that's what I see, and you see some of this through verification, you see some of it through networking, some of it in our own, local hospitals. And that's a problem for us in the burn community because we have data in publication about the volumes of therapies that are needed to avoid contracture, for example, based upon number of CFUs that a patient has. So we have information that show we need a certain volume of therapists to maintain quality. And I think for us, an opportunity for the ABA is to get behind those numbers and advocate for those numbers through the verification process. I think another opportunity for us in industry, in therapy industry, and I'm exempting Marla and Lisa because I know what they do and I know them personally, but what I see is that therapy departments are too passive in tracking their metrics and proving their worth to the organization administration. You see people tracking productivity, overtime, supply costs, but there isn't often a metric that is encouraged or used industry-wide to look at the quality of your care. So I think that's another opportunity for departments to improve and an opportunity for the ABA to lead the way with burn centers on how you can report that. And we tried that with verification now with the new PRQ and requiring our partners to track missed visits. So it's a beginning into a foray of looking at the quantity of your delivery and how it's impacting our patient's bedside.
Marla, Lisa, do you want to add anything more to that or to another area that you'd like to highlight?
I mean, I'll agree with everything Derek said in terms of, just the challenges. I mean, I'm from Canada, so it's a little bit different, but we certainly do have budget constraints. We have publicly funded dollars. We have to be, financially responsible with our money. So we definitely have challenges. I'm, lucky in that I do have the background of burn therapy, so I can advocate, to continue to have the therapists that we have. But there's always going to be challenges. Financially, and like Derek was alluding to, is maybe sometimes a lack of understanding of how long it does take to treat a burn patient, both in hours in the day, but the longevity of the time that it takes to treat them, sometimes years, sometimes the burn patient's lifetime. So it really is, very time intensive, and it is hard when maybe some of the non-burn therapy higher ups don't understand that. The other thing that I wanted to touch on, just to kind of move to a different challenge, is burnout. And kind of the burnout, all three of us have been in this career for a really long time. There's lots of, strategies that I've managed to avoid burnout in burn therapy, but I do hear a lot about burnout in this area of burn therapy. And I think that that's something that, as leaders, we can help our staff to better understand what is causing burnout, what we can do to prevent it, and that type of thing. And I think that, getting involved in things like the ABA has helped me to prevent burnout over the years, because I might feel burned out. I go to the conference and I just get this kind of reinvigoration. So I did want to touch on that a little bit. And then just recruiting our younger generation, right, is recruiting the younger generation and keeping them interested. And I haven't quite figured that one out yet, but that's another challenge that we have.
The only other challenge that I would have is more of a patient-specific challenge, and that's related to our patients who are underinsured or not insured, and even our patients who have insurance but don't maybe live at a distance or things like that from a burn center, and so maybe the expertise of a burn therapist isn't available to them. Those are all real challenges for our patients, and really impact their outcomes. And I think it's something that it needs to be top of mind for everyone, because if they don't have those resources, then they're not going to get the care that they need to live a healthy and full life. So
Yeah, Marla, that's an important point as well, and that aligns kind of to some of the things that Derek and Lisa were talking about. If ABA is to help in advocating for, the uninsured, right? Data is super important, especially when we're doing things either at a state or a federal level in the advocacy. The more data elements that we can add to our story, it gets better attention. And I think that helps not only for the profession of what you're trying to do in delivery of care, but also making sure the appropriate coverage is happening as well. And I just want to echo that point, and that's something ABA is continually trying to drill down into, gathering more aggregated data to kind of help the burn professional overall in the grand schemes of this particular area, because it's a growing issue, unfortunately. We've had some discussions a little bit in the use of technology, right? And technology can span so many different things. But part of our discussions have been around AI, and AI is, everybody's trying to get a handle on that. It's either an opportunity or it's a challenge. Where do you sit on it?
I think it's both, right? Like I think we're at the we're just looking at the tip of the iceberg here with what AI can do, how it can support the care that we provide, how it can support our patients and their outcomes. And I think it's really important that we all lean in to what AI is and how we can use it for good. I think there's so many tools that would, AI tools that would support us with what Derek was talking about in terms of efficiencies, data tracking, documentation, outcome reporting, really looking at what we're doing and how we're doing it. I think there's opportunities for wearable technology that could give us more information about our patients. That there's more opportunity from a research and a benchmarking perspective. And really, there's an opportunity, at least from a therapy perspective, when we think about patient and family education, and when we think about the opportunities for remote patient monitoring, therapeutic monitoring. RTM is becoming huge in electronic home exercise programs, and the ability to have the patient be at home and be able to, use technology to look at what they're doing, how they're doing it, and get that feedback. So I think there's a lot of good, but I think we have to really lean in to figure out how we can harness it and how we can utilize it. I think some of the concerns that I have is around the fact that therapy delivery is so individualized, and the patient factors are so individualized. When we think about pain, when we think about anxiety, when we think about post-traumatic stress, disorder related to how a burn happened, or maybe there was loss of family members, or all of those kinds of things. And AI doesn't know that, and AI can't help with that. And so it's really requiring the clinicians to still be present with everything that's happening in terms of driving the outcomes for our patients and driving the interventions that happen for our patients, and not have an over-reliance on AI-generated recommendations and things like that, because AI doesn't know all those patient-related factors. I do think access to technology could be a barrier for some of our patients who live more remotely, or maybe that have a lower literacy related to technology. And so that's of concern, right? So are we now separating out some of the population that can't access these kinds of tools? So that's something to think about as well. And I just think that there's, some accuracy and some bias related to some of the AI that we see. But again, it's exciting. It's an exciting time to be in healthcare because there's so much change happening and there's so much opportunity. It's just a matter of how we tap into it.
Absolutely, and I think that the AI in general, whether you're talking about physical therapy or if you're talking any other aspects of medicine, really, and how AI is being used, and even how patients are using AI, because that it all drives itself together, and it's a technology tool at the end of the day. How you leverage technology tools is the art of what everybody does, and I wish we had best practices that we could point our fingers to. It would help the community out, but I think that's all in development. So, Lisa, I want to kind of come back to an earlier point that you had outlined or touched upon, and that was really the resources that are available in various areas. And in my experience so far has been there's a wide variety of resources that are available, which creates opportunity when there's a large volume of resources available, and it helps the team dynamics and what you're able to do as a profession. But then there's the flip side of that coin. There are other places that are limited on what they have available. How do you all manage that? How do you talk about that within the community in order to help each other out in leveraging what you do have available? Can you expand on that a little bit?
Yeah, sure. I mean, again, with when I started my career, we didn't have the internet, we didn't have, all that. And so it really was, building that, creating that network, phoning people, having those chats. But now, I mean, I would imagine it's so much easier for new therapists now when we have, joining the ABA is really, really essential, I think, as a burn therapist. I mean, I cannot imagine being a burn therapist and not joining the ABA. The ABA didn't tell me to say that, by the way. I just really strongly believe in it. And so I think, especially because of the internet now, with having that online community of My AmeriBurn, I see questions all the time on the OTPT special interest group forum, and people are asking questions, and experienced burn therapists, non-experienced burn therapists reaching out. And the burn therapy community really is a safe community in that I've seen experienced therapists ask questions, and everybody's very, very, very generous with their information, and we all really have the common goal of helping the burn patients. So how would I manage the resources? I would definitely start with the ABA and seeing what, has been done. Most of the webinars, in my experience, have been recorded. So there's a place to get those recorded, the recorded talks, and to just kind of keep your eye on what is going to be presented, and taking the time to do that. If you don't have the time in the moment to join the live talk, then to go back and look at the recording. Just reaching out to, when we kind of go away from online resources, just really keeping your eye out for the literature. So making sure you stay up to date with the literature. Again, if you're not really understanding how to put into practice, reaching out to a more experienced colleague. So really, I think the theme with my answer is just networking and reaching out to others.
Absolutely. Thank you for that. We're closing in on the end of our discussion, but this has been really helpful, I think, to kind of highlight a number of things out there. But I'm going to ask each of you, Derek, I'm going to start with you here in a minute, what words of wisdom or resources would you point to that you think are important to kind of end our conversation on, whether that's in the literature or research opportunities or within ABA, outside of ABA? Where would you point people to guide them as they kind of get into the day-to-day aspects of therapy practice? So Derek, what's your words of wisdom?
I think Lisa gave an excellent summation of what's immediately available, and I would sort of back what she says. One of the most unique things about being in the burn community and the burn therapy community is you can know all the people. You can see somebody's name as an author on a journal article and be amazed at what they've done, and pick up a phone and talk to them and ask them direct questions on what's there. The community is very open, as Lisa described. It's very nurturing. It's very vulnerable. It's a wonderful place to be. I would add the mentorship program is another structured piece of the ABA that allows you to connect with somebody for a little bit more of a formalized relationship back and forth, and that usually builds friendships that are long lasting afterwards. So that's a great resource. Beyond that, I'm going to go in a different direction, and just because of things I see that kind of are missed in industry. I think for the United States anyway, understanding Medicare conditions of participation and knowing what your regulatory agencies say about delivery of your care so that you can be an advocate as a therapist for doing the right thing. You'd be surprised at information that is out there that is not widely known. And for example, for hospitals that take Medicare patients, you have to staff therapies to meet the needs of the patients that you serve. So as an administrator or a frontline therapist, if you're having a hard time getting enough resources to treat patients adequately, and can find a way to describe that and bring that to your administration against the backdrop of the conditions of participation documentation, you have something with a little bit of teeth and weight to it, And so knowing where you can go authoritatively is important as well. I think some of the other online communities that are out there really aren't too burn specific. I wouldn't, as a burn therapist, recommend going to them like Web PT, but there are some answers to basic questions that can be found fairly efficiently in those sources. But again, I would go back to Lisa's comment. I think that's the most valuable thing to share with our membership and the burn community is what the ABA offers through its platforms and its networking for our therapists and all of our practitioners, honestly, is the most powerful, direct way to get information that you need.
Thank you, Derek. Marla?
Yeah, I think they did a beautiful job of summing it up. But I think from my perspective, networking within the ABA, as Lisa and Derek both alluded to, is important. I would go one step further and say get involved. So being on a committee at the ABA is probably one of the most resource rich experiences that I've had in my career as a burn therapist, to be able to really get to know the other experts in the field and other advanced practicing clinicians. I mean, and even if they're a brand new clinician in the field, there's something to be learned from everybody, because a fresh set of eyes always brings in new opportunities to look at how we do things. So
No, thank you for that. Lisa, I'm going to end with you. What's
Sorry.
your final words? What's your final words of wisdom that resource-wise, or things that you would want to kind of point people to?
Yeah, I mean, I think that I'm not sure I have too much to add. I probably would be remiss to not go beyond the ABA and talk about the Canadian Burn Association, which is a great resource for Canadian therapists. And I mean, we're welcoming anybody, not just Canadians. We have other people that attend. And so it is a great smaller conference that really is modeled really from the ABA, has the ABA support, and is starting to develop a resource within just Canada and beyond. So I would be remiss in mentioning that as well. But, I think CBA and ABA go hand in hand. So that's probably the one thing I would add.
Thank you. Thank you, all three of you, Lisa and Marla and Derek, for just sharing a little bit of time with me and with the ABA burn community overall. We talk so much about the acute phases, but, and we're starting just to try to talk more and more about the chronic side of things, which is really the world you all kind of migrate to, and the relationships you have with these burn patients. So I appreciate you educating me, and I appreciate you taking the time to help educate maybe a little bit more in the burn community overall. So thank you again, and more to come. I'm sure this is not the last conversation we have.
Thank you for the opportunity.
All right.
thank you.
Have a great one.